So you had a tooth pulled. How long ago was that?
3 days ago.
On Friday. Okay. All right. And the pain started.
Right. You're not gonna like this injection here, but hang with me.
When did the pain start?
Yep.
Friday.
Hang with me. Hang with me. Hang with me. Here we go. Hang with me. Hang with me, buddy. You're doing good. Doing good.
And where are you injecting that time?
That was the long buccal nerve right there.
Okay.
Got it down on the side of that tooth a little
Uh-huh.
bit, and it numbs all this area right here.
Okay.
And
So
also-
you did an inferior alveolar block, and that didn't really take on him initially.
Well, it's working. See, normally when we do that, we have him open wide
Yeah.
to the nerve. He's close, so it's way, way back there.
Okay.
And it's hard to get back if you can't really open.
Yeah, yeah.
So-
Understood.
Tried to hit that, and now I just gave him a long buckle and tried to infiltrate in and around that tooth area also.
Okay. What are you going to use?
Gel foam.
All right, some gel foam.
This is gel foam.
All right.
It resorbs on its own.
And you're going to pack the gel foam in there. Now, do you irrigate that dry socket out at all initially?
It would be nice to, yes.
Uh-huh.
You want to irrigate the site, curette it if possible.
Okay.
Just to create some bleeding.
Okay.
You want a blood clot to form down there.
Right.
So everything we're looking for is in that blood clot.
Yeah.
Okay?
So you want a blood clot.
That is correct.
To irrigate that, what do you need? You need something from here, from us?
Saline, yes. We have just a syringe full of saline.
Say we can get a saline syringe. And we
Yes.
can get a catheter.
Okay, I'm going to use this curette. That's
Okay.
going to help us irritate the site a little bit.
Okay, cool.
Okay? And that's going to help us pack our gel foam.
Okay, so this is dry socket paste, and it's got eugenol in it and some other stuff. That's your saline. Here's some more saline if you need it.
Okay.
So we got some more backup on that.
All right, thank you.
And that eugenol really smells like eugenol, so kind of like that smell.
I'm just going to grab some out of here.
Okay. You're gonna just pack that'll end up packing inside that. Okay.
Yeah. I'm just going to coat it pretty much.
So how do you diagnose a dry socket for our audience?
Okay, pretty much, let's say someone's had a tooth extracted, it mostly happens on the mandibular arch,
Okay.
the bottom arch.
Okay.
Now what happens is, when they lose that blood clot, either they suck through a straw, or they spit, or they start smoking, the blood clot dislodges, and that leaves exposed bone, okay?
Okay.
Normally happens 2 to 3 days after the extraction.
All right.
They'll start having extreme pain, such as this right here.
All right.
And that's pretty much your indication for a dry socket.
Okay. All right. Good. You weren't smoking, were you? All right.
Just asked the same thing. I ain't remember seeing them smoke. I think the pain got worse Saturday night.
You don't mind being on YouTube or anything like that? Okay. All right.
Alright. Just let me slide this in here. Right there on your cheek.
Alright,
Just on your cheek.
alright,
Okay. I
alright,
don't know if you can see back here.
Uh-huh.
alright.
Okay. Hang with me now, buddy, okay? Yep. Yeah, you gotta hang with me now. You gotta hang with me.
So you're digging that.
Yep. See all that debris coming out? That's just food packed in there. You're doing great, buddy. Turn toward me a little bit. Okay. I'm gonna try and hold all these at once. Relax that tongue for me.
It doesn't bend real well, but
No, it's okay. Doing good, buddy. Yeah, that's like still wide open. Wide open.
Is
I don't
it?
know if you can, yeah. I don't know if you can see it now. You're doing good, buddy. Yep. Hang in there with me now. Yeah, there's more stuff in there. Hang on, buddy. You're doing good. You're doing good now.
Now what are you doing?
Just getting this little piece out. Right here. All right, now we're going to back in our gel foam, okay?
Alright.
Kind of roll it up a little bit in the ball. Or in a roll, okay?
All
I'm
right.
just going to pack it in there.
Okay.
Okay.
Is he going to have to bite down on that then?
I'm going to give him some gauze to bite down on.
Okay.
Open up for me. I want to pack this inside the socket. You got to open up for me now. Yep. Hang with me. Hang with me.
This will be the worst part.
You're doing good. Okay, relax, relax. Take a deep breath. Take a deep breath. Take a deep breath. Okay. All right, go ahead and relax. Go ahead and relax. So see how I packed it. And it's normal to be painful like that.
Yeah.
It's going to happen.
Yeah.
You did good, buddy.
It actually starts to feel better though, does it not, once
It
you
does.
pack it like that?
It should, and especially as time goes on, it'll start to feel better. So normally we repeat this process one more time, and then he should be fine.
How many days afterwards do you end up repeating that? 2 or 3 days or
We'll repeat this tomorrow.
tomorrow? Okay.
And then after that, he should be fine.
Okay.
Okay.
So he's going to come back to your clinic tomorrow
That
then?
is correct. He'll
Okay.
come back, we'll repeat the process. If we notice a drastic improvement, we may just leave him alone.
Yeah.
But if he's kind of the same, which can happen,
Okay.
we'll go back, repeat the process, and then he should be fine again.
Okay.
And that's all we're gonna do. Okay?
It's going to be some gauze to bite down, all right? Is that helping you a little bit already? Yeah. If you're still having a whole lot of pain, one of the things I want to do then is inject some numbing medicine around C6, C7 in the back of your neck on both sides. And that actually helps dental pain, it helps headaches, it helps face pain. And hopefully that would take away whatever is left. So if you're still having some significant pain despite 10 milligrams of morphine and what we've done right now, I'll do the cervical injections on you. All right? All right, now on a scale of 10, how bad is the pain?
Got back down to about 8.7.
8.7. I think you'll need a cervical injection then.
All right, buddy. If you just look toward me, let me give you some gauze to bite down on, okay? That's all I'm gonna have you do.
Bad part over with, man.
Yeah.
There's a tear in this man's eye. We made a grown man cry.
You open up for me?
The worst part is over with.
Yeah.
That's right. You're on your way to recovery. As wide as you can, buddy, like you did last time. I'm gonna slide this back here. Go ahead and just bite down on that. There you go. That's all you need to do.
We're still having some pain, and so we're going to go ahead and do these cervical injections. And I think this will help. I'm going to have you keep your head up just like that, and vertebra prominence is about here, about C7, and I'll probably go right where he has the creases, the natural creases. And so I use these Pain-Ease, which is a topical vapor coolant, and that reduces the discomfort. So I'm going to spray, and sometimes the cold is almost worse than the needle stick, but I spray it on there, and then I do some distracting pressure with my other hand and with my other finger, and you bury it in there. And there's nothing there on anatomy, and I'm going to aspirate back a little bit. I don't see any blood, and so I'm going to go ahead and inject that in there. I'm going to inject slowly. Is that hurting too bad?
Almost done, baby. It's almost done.
Is he breaking your fingers?
No. Almost done.
Because 1.5 on that side. All right, and we'll just
One
go to
more
the other
time.
side. You go
One more
parallel,
time. One more time.
and we're going parallel to the bed because we don't want to go down and drop a lung. That wouldn't be a very good thing. My patient wouldn't be happy.
One more time.
All right, so again, I'm kind of going around C6 level, going in there. It always hurts a little bit more on the left side because I think the needle's been used. I aspirate back. I had one patient one time that I was just chatting away, and I was at the pain clinic, and I didn't reckon. I looked down, and oops, there's blood in there, and I hadn't paid attention. But she got real sleepy. She got real sleepy. That was all. She just got sleepy. She said, "I'm so tired." Check again. So. Because you can hit a vein. All right, and that's it. So 1.5 ml on both sides, and a lot of times I'll massage it in there, and if they have any bleeding, I'll just put a little Band-Aid on there. But and that's basically it. All right. So how many minutes do you? How long ago did I just do that injection?
About 3-4 minutes ago.
3 or 4 minutes ago. At the most, maybe 5. All right. So, is the pain? We turn the lights out for the effect of. But is your pain gone now?
Yes.
It's gone.
Mm-hmm.
It's gone.
Yes.
Okay. All right. That's what I wanted to hear.
All right.
All right. Thanks so much. Get some rest.